The Bright Path Center came about because of the realization that mental health crisis and substance abuse crisis deserves a front door. Too often, when somebody is confronted with a crisis situation, they don't know where to go. They don't know where to turn. And it's not always a matter of that services not being there. It's a matter of not knowing how to access those. So several years ago, many stakeholders got together and decided there has to be a better way. And that is the genesis of this idea, the Bright Path Center.
Should I go to an emergency room or should I go to a crisis center? If their primary problem is a need for psychiatric intervention, it is a lot quicker and safer here.
So the Bright Path Center represents a place where people can come that is safe, welcoming, and is going to provide them with the services they need regardless of what they're experiencing and what's triggering or driving their behavioral health crisis. This is a place that they can find hope and care and a sense of support and hope for the future, and a place where they can recover from the behavioral health crisis they're experiencing at the time. Walk-in crisis care, phone intervention care, medical withdrawal management. They will also have the ability to go to one of our crisis residential beds. So having all of these services provided under one roof creates a continuum of care that individuals can navigate through depending on their needs. It does kind of plug a lot of the holes in our system. Specifically here at the Bright Path Center, we've created two entrances. One side is for adults, the other side is for adolescents and children. That was done intentionally so that kiddos can get a different kind of attention that we all would recognize they would need. And the adults can then be focused on in their own area, and keep those age groups separate is really important.
This level of care is designed for both adults and adolescents who are experiencing some level of mental health crisis. They may not need inpatient hospitalization, but they're not quite ready to return home yet. So we are able to provide a safe place for them to stabilize, learn some coping skills, and gain some additional supports before going home.
The environment here at Crisis Res is intentionally created to feel relaxing, calm, and safe. We want people to come here and feel like they have a place to relax while they stabilize, and we want them to be able to feel respected and supported by our staff at all times. The kind of support people can expect to receive includes med management, individual therapy and group therapy, as well as peer support services. We focus on emotional safety and support, as well as crisis stabilization, and helping individuals get back to a place where they can return home feeling safe and supported.
Crisis care for children and teens at the Bright Path Center is designed with development in mind. We tailor how we communicate, assess, and intervene based on the child or young person's physical age and developmental stage. We focus heavily on emotional regulation, family dynamics, and environmental stressors like school or peer relationships. Most importantly, care for children and teens is not just about the individual. It includes the entire family and their support system as key components of that care and process.
Bringing your child to Bright Path Center does not mean that you failed. It means that you recognize that your child needs additional support and you took the steps to help get them that support.
A big part of behavioral health problems can often stem from substance use disorder. It's sometimes difficult to tease out how much is coming from the substance, how much is coming from an underlying illness, and that's what the assessment is for. Here at Bright Path, we'll have a detox unit available to immediately initiate treatment. Individuals' interest in getting treatment sometimes doesn't last, and so we want to make sure that we take the opportunity to initiate treatment immediately without having to wait for the availability of a detox or rehab bed somewhere else. We'll have nurses and doctors available around the clock to support folks, as well as counselors and peers to make sure that it goes well.
Our goal isn't just to treat symptoms and diagnoses, it's to help our youth feel safe and supported while they're here at the Bright Path Center.
I would say folks coming through the door for the first time, although there might be a lot of fear and anxiety about doing that, they could rest assured that they're in the right place and doing the right thing by seeking help.
Success means someone is more stable, more grounded. By helping people feel more supported when they're discharged, we're hoping to reduce the likelihood of future crises.
Bright Path Center takes away the question of where do I go and makes it I know where to go. The Bright Path Center is proof of what can happen when a community stops talking about the problem and starts talking about solutions.
Bright Path Center. It reflects what can get done when we all come together. State and local governments, healthcare providers, community-based organizations, and others to prioritize a shared commitment to treatment, recovery, and healthier communities.
Today, we can look ahead to a new way of doing business together. As the saying goes, the windshield is bigger than the rearview mirror for a reason. And that is because what's in front of us is so much more important than what's behind us. Our community has so much to look forward to with the Bright Path Center.